At 6:39, millions of Americans are ready to spend the holidays with friends and family, especially after being apart because of the pandemic last year. But it's important not to let your guard down. We're seeing COVID cases rise all across the country, which includes people who have been vaccinated. Joining us now with more on the efforts and ways to stay healthy and protected during the holidays, Dr. Paul Burton, who is Moderna's Chief Medical Officer. Thank you for joining us, Dr. Burton. First of all, are you concerned about the holidays coming up? Because we've heard Dr. Fauci say he is a bit concerned about that.
Eric, good morning. Thanks for having me. Look, the holidays clearly are a time when people are going to be indoors and they're going to be mingling. We know that Omicron is highly transmissible. We don't need to panic, but I think we do need to be cautious and sensible and take this variant very seriously.
And so far from the results we've seen in South Africa where it started, it did spread very quickly, but it was not, in most cases, anything serious. It was more of light conditions. Should we be that worried about Omicron? Because Delta is still the big problem here.
So Eric, look, yeah, it is. We should not forget Delta. Omicron, I think, is a serious contender. When you look at data from Denmark, the hospitalization rate for Delta was about 0.7%. Well, the hospitalization rate with Omicron is about 0.8%. So it's right in the same ballpark. And, when you look at the data in South Africa today, there's about 7,500 people in hospital. 15% of them are in ICU or on high dependency. This is a variant that's spreading very, very rapidly. As you said, 140,000 people in the US yesterday, 88,000 people in the UK. I think this is a serious variant.
And how much do we know about Omicron right now? And is it as deadly as Delta, or we just don't know that yet?
No, I think that's a great question, Eric. I think it is less deadly, certainly more transmissible, and I would think probably we'll look back and see hospitalization rates that maybe are a little lower, but not insignificant. And, Eric, the issue that I think we see or are going to see with Omicron is sheer numbers of infected people, particularly here in the winter months. People a little older, we have some comorbidities. People will be impacted by it. So that's what we've got to prevent. That's with mask wearing, some distance, and getting boosted.
And for people who are fully vaccinated and boosted, we are seeing some of those people get Omicron and still even get some breakthrough Delta cases.
Yes. So, Eric, I think the key is when were you vaccinated and when were you boosted? We know that Omicron is able to escape some of the neutralization that antibodies with vaccination bring. So if you've been vaccinated, absolutely get boosted. And you can go to makeityourvaccine.com. It's a great website, gives you information about it, where to get vaccines. Talk to people you trust, and get boosted.
Quickly,
I think it will be enough to get us through this season.
Quickly, are you concerned that because we're kind of letting our guard down, we all have this pandemic fatigue, that we will see a huge spike because people don't want to mask anymore, they're congregating and things like that?
Yes, I think, Eric, that's the risk that we all face. We can't let our guard down now. We've been at this for 2 years. We can get through it, but we've got to take it seriously and we've got to take those precautions. Get vaccinated and get through the holiday.
All right, Doctor, thank you very much. And if you'd like the latest news regarding COVID-19 vaccines and vaccination locations in our area, you can text the word VAX to 504-529-4444. We'll respond with a link that'll lead you to all the information you need that's on our website. Leslie?